Welcome to Sakshi TV and welcome to the show, Ask Your Doctor. I'm Sanjana Chekuri and I'll be your host for today. And today I have here with me a very special guest, Dr. Mohini Rawat. Dr. Rawat is the president and founder of Mohini Rawat Physical Therapy, PC, and she has successfully treated thousands of patients by providing comprehensive direct patient care in broad scope departments ranging from orthopedics to neurology to sports injury. And she's adept at guiding her patients through the treatment that she's providing them and empowering them to get to know themselves better by communicating their conditions with precision and clarity. I'm super excited to hear everything that Dr. Rawat has to say, as I'm sure you all are too. So without further ado, let's welcome Dr. Rawat.
Thank you for having me. It's a pleasure to be here. My name is Dr. Mohini Rawat and I am board certified by American Board of Physical Therapy Specialties in Orthopedics and Clinical Electrophysiology. And in addition, I'm also board certified in musculoskeletal sonography. So what this means is like these certifications are more about a type of like diagnostic specialties which gives a better understanding or deeper understanding of the reason why someone has a problem. So that's just like a simplified way, like in layman term, of what these certifications give me.
Okay, and I wanted to kind of segue into if you could talk about what piqued your interest to get into this field, and are there any specific areas that you specialize in?
Yes, so I always had interest in anatomy and biokinesiology, and what that means is basically the movement system of our body, the framework, and the movement science, how body moves and different musculoskeletal structure interact to make that movement happen. So during my master's in University of Southern California in LA, I had the pleasure of learning biokinesiology from some of the best minds out there, and I also had a good fortune of learning different imaging tools like MRI, CT, and ultrasound, and we got to compare them. So my master's thesis was on learning how different tissue like tendons look in different population, like someone who is a runner versus like someone who has disuse of that, like spinal cord injury patients, and or a normal person, sedentary person, or someone who is suffering from some type of tendon disease. So that's where the interest started, and I'm like, this is an amazing tool. It doesn't just give us like one snapshot of what's happening in the body, but also gives us detail in real time of how that tissue is interacting with other structures around the joint. And then I moved to East Coast, and again, it's like a circumstance and good fortune that I met my mentor, Dr. Dimitris Kostopoulos, who's is based here in New York, and he had the right environment for me to delve deeper into this specialty, and that led to the board certification, and then later on we developed our program to train more clinicians in this area.
Very nice. And I think it's interesting how you said that it's always that mentor, just hearing that one thing that kind of inspires you to get into this route or just learning more about a topic. And with that, I kind of want to segue into if you could talk about physical therapy for anyone who might be interested to learn more. Maybe you might inspire someone here. So just what is the type of services that are offered with physical therapy, and what are some of its benefits?
Yeah, so physical therapy is the area within or physiotherapy. Some people know it by physiotherapy. So physical therapy or physiotherapy is an area within healthcare that deals with movement dysfunction. So in short, physical therapists are movement specialists. There are different specialties. So the most common or the most popular one that we know is orthopedics. So when you talk about physical therapy, people think, okay, yeah, it's like some type of sports injuries or some joint problems or some tendon problems. But there is more to physical therapy than just orthopedics. So at present, there are 10 different specialties under physical therapy. Of course, orthopedic, everyone knows that, sports, there's pediatrics, there's oncology, cardiopulmonary, then there is wound management. So there are like 10 different specialties. So depending on who has what kind of movement dysfunction, so going back to the same thing, it all ties back to movement dysfunction, and people across different age group can suffer from any problem related to movement dysfunction, from newborn to people at the end of life. So we basically help those people, and there are 3 important things that we do in physical therapy. One is patient education, which is the core center. Then there is hands-on care, which can mean different things for different specialties within physical therapy. And the last one is prescribed exercises, or it's not really in that order, but 3 important things that physical therapy covers.
Thank you for the overview. I think definitely for people that just want to know about physical therapy, that's just a great introduction. And maybe you could also talk a little bit about what are some of the common conditions that you encounter on like a daily basis as a physical therapist.
So speaking for myself, my practice is a specialized practice, one-on-one patient-centric where I treat active adults with lower back and lower extremity problems. There are other practices out there. They take care of different type of problems. It could be like upper body, or sometimes like people go to physical therapy and they specialize in shoulder dysfunctions or cervical spine, but mine is focused more in the lower extremity and lower back. So that's my area of practice. And what usually happens when you come to a physical therapy practice is you get a comprehensive evaluation. So first we ask you some questions. The evaluation means some history taking, really getting to understand how that problem started. Then we do some special test which helps us gain some more information about that problem. And once we reach that stage where we have good grasp of what's going on, what's the reason behind the movement dysfunction that patient has, that could be knee pain or lower back pain, then we set some goals which are meaningful for the patient. So I'll give you example of meaningful goals. So there can be 2 different patients with knee pain. So one patient has knee pain, but it's really important for them to get back to running. And then we have a second patient who also has the knee pain, but it's very important for them to be able to get back to their daily activities. And the most important thing that they want to get back to is to be able to stand from sitting and at the same time holding their grandchild. So we tie it to that meaningful goal, and that's how it works very well. And so, that's the general picture of how it works.
Right. And I think you led me straight into my next question, because I was going to ask you about your approach as like a holistic and patient-centric way of getting to help them accomplish their goals. But getting into that approach, I'm sure that you would agree that their diet is equally as important in maintaining and helping them achieve their goals. So as a physical therapist, do you usually recommend any particular diet to help them achieve their goals?
So I'm going to break down this answer into 2 parts. So let's first talk about holistic. So what do we mean by holistic? Holistic means taking into consideration the overall picture. When a patient presents to you, they are not just coming with, you cannot have a narrow approach where you're just looking at one structure and just focused on that. You have to take into consideration their overall health, which could be mental factors, mental health, or social factors, or anything else coexisting. Maybe sometimes people have a lot of stress in their life, and or maybe the other coexisting medical condition is also making that musculoskeletal pain worse. So that's what I mean holistic. I know there are, if you look out there are so many definitions of holistic. So I'll give you an example from my area. If I'm treating someone for, let's again use knee pain, okay? And we have again 2 different patients. One who just injured their knee running, or maybe lifting something heavy, twisting their knee over the weekend, compared to someone else who's also happened to have diabetes, and now they have this flare-up of the pain, and maybe they have some other metabolic function. So the approach of treatment is very different. And sometimes you may have to involve other specialists in the care. So you have to approach the problem taking into consideration other factors, because you may be able to address their musculoskeletal pain, but you may not be able to address other things. So you have to involve and make sure that you give them right education so they can manage their pain better. So my focus is always to make the patient independent so they can take care of themselves and understand their problem. Now, getting back to the second part, which is the diet. There is, in this era, we have so much information out there in social media, and there are some goods and bads, and there is a lot of information and misinformation. And I would say there is no one size fit all. You cannot blindly follow one type of diet over other. You have to treat yourself as someone who's unique and you have unique needs. And one thing that has been tested throughout, and it's like tested, and I'm saying tested, the test of time and also research, is if you have a balanced, nutritious diet and active lifestyle, that's the best thing you can do for yourself. But if you think you need some recommendation about what kind of diet or health supplements, I would say seek consultation from specialists who specializes in that. I won't say we don't completely disregard that. So when someone is coming, it's not like, okay, you eat this food and that's good for your bone health. It's like I said, it's not one size fit all. So there are so many factors that you have to consider when you're asking someone to make major changes in diet or supplementation, their medical conditions, their physical demands, their age. Do they have any deficiencies? Sometimes we take, supplements and we are not even deficient in them, versus there are some deficiency, but you don't know about that. Mm-hmm. So I would say always, education is always good, so you go to the healthcare profession who you trust, so you can take better care of your health.
Very well said. I think we all know, we're all victim of it, that we've tried some crazy diet that we saw online. So definitely trust your credible specialists who know what they're talking about. And you also talked about the importance of education, and you yourself are an educator along with an author besides being a physical therapist. So could you talk a little bit about that?
Yeah, sure. So that's my time is divided into. So I have two main roles. One is clinician, the other one is educator, and also I also dedicate some time to research. So I'm a researcher and educator along with clinician. So the education and research actually go hand in hand. And education is for clinicians who want to learn the diagnostic musculoskeletal sonography, so they can again get to understand their patient's problem better. So we have, so I'm a president and co-founder of American Academy of Musculoskeletal Ultrasound. Our main headquarters is in Astoria, New York, and we teach courses. I've taught 150 courses so far, trained hundreds of clinicians, and reviewed 20,000 studies. So that's something I'm passionate about, and I think it's such a great tool to really learn about patient's problem, and you can also educate the patient using that. So you can show the patient their tissues, how they're moving in real time, and show them exactly where it hurts. And that education works wonder in both for clinician to learn about the patient's problem and patient to learn about their own problem.
Right. So well said. I think this education keeps you young in terms of your professional experience and just learning all the new information out there when you apply it to your own practice, and quite literally young as well. But I also wanted to get into, if you could talk about the misconceptions surrounding orthopedics and physical therapy being the exact same thing, and how you educate your patients to realize that they are two different things, and when they would come to a physical therapist as opposed to going to an orthopedic.
So yeah, these terms are used interchangeably. Mm-hmm. So I'll talk about orthopedics. So orthopedics is a field in medical science which deals with musculoskeletal system, and by musculoskeletal system we mean the skeletal framework or the moving parts of your body, which includes muscle, tendons, cartilage, joints, nerves. So that's all musculoskeletal system, and that comes under the umbrella of orthopedics. Mm-hmm. Now there are different specialists who work under this umbrella of orthopedic, like orthopedic surgeons, then physical therapists, sports medicine doctors, physiatrists. They all work under this umbrella. Right. Now they have different roles, but they're all treating musculoskeletal problems. So that's the difference. Now, like I mentioned earlier, physical therapists are someone who would help you with your movement dysfunction in a conservative approach. So that's the difference. So if you need a surgical consult, you would go to an orthopedic surgeon. If you want to manage it conservatively, and we work together, like it's a collaboration, because again, we don't work in boxes, and healthcare is more of a collaboration than just like your own separate island. So sometimes there is a patient goes for surgical consultation, they send the patient back to physical therapist for conservative care, or sometimes we think the patient is candidate for surgery or maybe some type of procedure, and we refer them there. So it works as a collaboration.
Right, that makes sense. And I think this, you were mentioning earlier about it not being like a one size fits all. It's not like you go to one doctor, you're solved, or you go to a physical therapist and you're solved, right? It can go in many different ways. And kind of going off of that topic, obviously you said that there's different approaches based on the patient's age, their lifestyle, their flexibility, their goals. So is there any specific way that you like to work your approach for like patients when you set up their plan?
Like I said, it's patient-centric, so it's all focused on the patient. So after evaluation, we find out what the problem is, and what is patient's expectation, what's their goal. For some, it could be going back to their marathon, or like running, or just like, hiking over the weekend. For some, it's just like playing with the grandchildren. And so it all ties back to the goal of that treatment, patient's expectations. And that's how we approach it.
And also, this is one of my favorite questions to ask individuals in like healthcare. But how satisfying is it to know that you are making such an impact on people just to get back to their daily functions and just live their life to the fullest? Because even for someone who wants to just be able to hold their grandchildren, it's very rewarding to be able to be on the flip side and help them achieve those goals, right?
That's true. It is rewarding and gratifying. That's true. I feel like proud of what I do, and I have a lot of satisfaction from the type of work I do.
Right, that makes sense. So one question I wanted to ask you is regarding joint pain. So joint pain is pretty common nowadays, and oftentimes when people go to their physicians, they do hear a lot about just joint replacement. But I wanted to ask if physical therapy could possibly act as a substitute for joint replacement, so patients can work through physical therapy as opposed to opting for surgery.
Yeah, so physical therapy is central in the treatment of joint pains, whether you are a candidate for surgery or you're not a candidate for surgery. It's rare to see joint replacement as the first choice of treatment. Usually when you go, even if you directly go to orthopedic surgeon, they would want you to do physical therapy first, and then come back for a follow-up and see if you still would benefit from joint replacement or not. So whether, like I said, everyone is different. So I don't want to use a blanket statement to cover everyone. There would be some people, they are candidate, but it's always like you try the physical therapy first and see if it helps you. If it does, and then that's the best course. Now, if someone is a candidate for joint replacement and they go for surgery, there is pre-surgical and post-surgical physical therapy. So you would still get physical therapy even if you're going for joint replacement. Now, role of pre-surgical physical therapy is to prepare your joint, your musculature around the joint for after surgery recovery. And when you get the surgery, then the physical therapy will help you again get the movement back in that new joint. So joint pain is not just joint. There are peri-articular structures, like there are soft tissue around the joint which you have to take care of, and most of the time they are the pain generators. So I would say physical therapy is central, and it helps with any type of joint pain.
Got it, right. Again, we saw that there's many different terms under this umbrella. There's obviously pre-operative physical therapy and post-operative, so I guess it applies in every way possible. And one thing I wanted to ask is, what do you wish patients knew more about regarding physical therapy that many people often overlook?
So that would be about their own bodies. I would say resilience. Our bodies human body is complex but at the same time beautiful. We are especially our anatomy is like so complex and beautiful at the same time. So the resilience is something I would want like most people to know. When we are in pain, there is joint pain and our world shatters and we lose hope and we look for quick fixes. Those quick fixes seem really good, like popping a pain pill, or like, you know, getting a new joint, or like some type of injection, which there is place for everything. I'm not saying it's a no for everyone, but if you tune in with your body, listen to your body, and get the right advice, there is so much you can do. You can get back to your original self, your functional activities, activities that you love or you need to do in your daily life. So I would say resilience is something I would want everyone to be aware of.
You could talk a little bit about the importance of exercise for human body, speaking from a physical therapist point of view.
Yeah, so exercise again is very important, and movement is life.
Yeah.
Right, so I always use this phrase with my patients, like motion is lotion. So movement is life, which is like, you know, central to like human life. So movement is very important. Our joints need it. You would think, you know, for a certain condition maybe I need bed rest, but no, it's with research we are learning more and more now with joint replacement. As soon as they replace the joint, they ask the patient to get up and start walking with the walker. So early movement, early ambulation is encouraged, like right after even major surgeries like that. So movement is very important. And exercise, especially keeping a healthy lifestyle. Again, you know, it's boring. Most of the people do not exercise because it's boring. So you have to really tie it with a goal or like something, activity that you enjoy. Now, benefits of exercise are multifold. We know, everyone knows, when you exercise, you have muscle strength, improved tone, but we also have other benefits like there is improved metabolic function, improved bone health, improved cardiovascular, again, you know, one of the main benefits. There is decreased fat in the body, improved balance and coordination, and improved cognition, which means it also improves your brain health, so there are so many benefits of exercise. Also, when we age, and especially when we turn 40, there is a slow and steady decline in muscle mass, which we call sarcopenia. And so it's due for everyone, sarcopenia.
Unfortunately.
Yeah, but just doing exercises just 2 to 3 times a week, you can reverse that process and lead a happy or healthy life. So, you know, some activity just have to be like, just enroll in something. Even if you find just going to gym really boring, or some physical activity, and you don't have to do it a lot, just enough so you don't get the sarcopenia or you reverse it.
Right, and there's so many different fun ways to do it. Like you said, you can do sports, you can do any activity that you like, but just getting yourself moving so you keep yourself healthy and avoid that process. But finally, I wanted to ask you if there is any last point that you'd like to say to your Sakshi TV viewers today.
Yeah, sure. So I would say, like all the viewers who are watching, if you are suffering from any joint pains, or if you have any low back pain, any musculoskeletal issue, make sure that you go visit a healthcare provider that you trust. And then once you go there, make sure that you make those goals with them, and do not forget the resilience of your body. You can do it, and you can get rid of that pain if you put your mind into it. I would like to thank Sakshi TV for having me, and thank you to you for this great interview, and thank you to all viewers for watching this.
Thank you, Dr. Rawat. It was a pleasure to truly hear everything surrounding physical therapy and just about ways in which our body is so capable and how we are so resilient. I think that's a message that you can take and apply to any aspect of your life. It was a pleasure having you, and I'd like to thank all the Sakshi TV viewers, and I hope you guys enjoyed and learned through this interview. So once again, signing off, I'm your host, Sanjana Chekuri.